Welcome to the Health Channel, all health, all the time. I'm Kathy Buccio, coming to you from the Baptist Health South Florida studios. Now, according to the American Heart Association, about 1 million people are diagnosed with heart valve disease each year. So what is this condition that affects so many people? Today on the Health Channel, we'll be talking about heart valve disease, including how imaging technology helps treat it. And joining us today is Dr. Elliot Elias, interventional echocardiography specialist at the Miami Cardiac and Vascular Institute. Welcome, doctor. And I have to make a correction before, because it's 5 million people that it affects. So tell us a little about what you do first in your field.
So I'm an interventional echocardiographer, and what that means is it's image guidance for heart valve disease procedures. If you think back to 20 years ago when surgeons would operate, they would have all the anatomy in front of them when they were doing a procedure. With the advent of technology and with patients getting older and sicker, we're able to offer patients a non-surgical way to treat their heart valve disease. My role specifically is to guide these procedures from an imaging standpoint so we get the best and optimal result for these patients.
Now, what is the difference between an echocardiogram or an electrocardiogram, EKG?
Yeah, so an echocardiogram is really looking at the heart as a beating structure. Okay. It's a dynamic structure, and we use ultrasound waves to get that image. An EKG really looks at the electrical conduction of the heart, and you're looking at it on a piece of paper and understanding how the conduction helps beat the heart from one moment to the next.
So when seeing a patient, a doctor, do you usually use both or just one source of imaging?
Yeah, so as cardiologists, really, we have an ample amount of information in front of us that we really have to use. In our specific field in valve disease, our main modality to look at valve disease is echocardiograms, but an EKG is always really helpful to get a full picture of what's going on with the patient. And
an echo is, like, as you mentioned, is like an ultrasound, correct?
Yeah, so we're with the machines that work, as you can see on TV, you have a tech there that's scanning a patient, and then they have a dynamic image in front of them. And what she's doing there by looking at all and pressing all the knobs is she's able to visualize the heart as it's actually beating, and then they produce an image from ultrasounds, and then that feeds back to the doctors who are able to interpret it and get a full picture and relate it to the patient's symptoms.
And doctor, correct me if I'm wrong, would an echo be more reliable, let's say, in finding out the full picture of the heart as opposed to an EKG, which might just show at that moment?
Yeah, so an EKG looks at specific things that are not, in a sense, a real-time image. In echocardiogram, you're really looking at the heart itself as a whole and beating structure, if you can think back to the images that the tech was getting. From there, you're able to look at all the valves of the heart and look at all the chambers of the heart, the pressures, and be able to put it into a patient's symptoms and correlate it to what symptoms are affected by what processes in the heart.
Now, echocardiology is so important when it comes to newer interventional heart procedures. Because of echocardiogram technology, less invasive procedures are now available. And this is something that is mind-blowing. Is this true?
Yeah, so way back just 10 years ago, surgery was the main staple for treating heart valve disease.
Right.
You know, people weren't being operated on because they were too high risk. As technology has evolved and as the field of cardiology has evolved, we've been able to offer patients that were not operated on by surgery because they were too high risk another chance of, or another way to actually treat their heart valve disease. So the way that echocardiography comes into play is during these procedures, we can actually image what's going on in the heart. Because these procedures itself, you're really just going in through your groin to access the heart or through your arm. And you're really looking in a confined space, so it's important to have the best imaging that you can and figure out everything that's going on in relation to the procedure.
And that minimally invasive option is so fascinating when it comes to heart surgery. And now, before we talk about your role in the treatment of valve disease, I want to first get a little anatomy lesson of the heart. So we have a 3D model that shows us where the valves are in our heart and what their function is. So, Dr. Elias, if you can tell us what are the 4 valves and their functions in the heart, please.
Yeah, so here I'm actually going to start with the aortic valve, which is the valve that everybody's the most familiar with. If you're looking at the heart now, you see that the main aortic valve is pumping into the aorta the amount of blood that's going to circulate through the whole body. After that, you can see the mitral valve here, and that allows the blood to flow from the lungs and to start going through the aorta. The way that most people divide the heart is into the left-sided structures, which are going to include the mitral valve and the aortic valve that we just talked about, and right-sided structures, which are the tricuspid valve and the pulmonic valve, which is not shown.
Okay, so now that we know a little bit of the functions of the valves, so how does valve disease happen?
Yeah, so over time, if you can imagine, you're pumping around 60 to 100 beats per minute in the average patient, and there's a significant amount of blood that's going through the aorta. With time and age, there's fibrosis and calcium that's usually going to occur in the aortic valve, and with that amount of with a certain amount of time, these valves are going to calcify and they're going to become either stenotic, and in some cases they may be leaky.
So when you say leaky valves, that means what exactly, Dr. Elias?
Yeah, so the 2 things that you want to think about with valve disease is either that it's going to be stenotic or that it's going to be leaky. When I mean stenotic, it just means that the valve cannot cannot open as much as it normally does. And when I mean leaky, it means that there's too much blood that's going in the opposite direction from where it normally goes.
Okay. Now, according to the American Heart Association, aortic stenosis is one of the most common and most serious valve disease problems. So what exactly does it mean to have if someone has a stenotic valve, Dr. Elias?
Yeah, so from a stenotic standpoint, what you really want to think about is that your valve is not opening as much as it should be.
Okay.
So when you look at this picture here, you're seeing all this little debris, and what it really is calcium in most patients. And because of that, you can see that the little speckles of blood cells are not they're not coming through the valve as they normally should. And because of that, you're not getting enough oxygen to the brain, and you're also putting too much pressure on the heart because it's having to pump with an abnormal amount of force through such a closed and tight valve.
And this obviously can be corrected through some of the minimally invasive procedures that we're going to be talking about, correct?
Exactly. Yeah, so one of the most common procedures that's available, or actually the 2, are going to be surgery and a non-surgical way to open up this closed valve so you can get oxygen and allow the heart to beat as it normally should.
So the leaky valve, that's same thing as the regurgitation that we're talking about? Is that sort of what we're seeing in the image here?
Yeah, so actually in this image here, we're really looking at a valve that's too stenotic or closed. When you have a leaky valve, the valve is allowing too much backflow through the heart. And if you go back to the prior image, I can show you that the mitral valve is one of the most common valves that we're currently operating on to fix the leakiness. So if you have the mitral valve here, if you're allowing too much blood to go backwards with your regurgitation or leakiness, then it's going to go back into the lung.
Now, what's more common that you see? Is it the stenosis or the regurgitation in a patient with valve disease?
So they're actually about the same.
Okay.
I mean, aortic stenosis is the one that we're very familiar with, so overall I would say that's more common. But with valve disease, you're treating both of them in equal similarity.
Now, doctor, I know we're going to get into this a little more later, but is it more of an age factor, or is it more genetic, or is it something, again, like lifestyle modification that causes valve disease?
Yeah, so one of the most common things, risk factors, actually is age. I mean, with time, you have a certain amount of pressure that's going to be put on all your valves. So over time, there's going to be a certain amount of changes and deterioration with the valve structures. There's other risk factors for everybody, such as genetics, that cause you to have a valve that's diseased. We've had a couple patients actually this week that were, 20, 30, and 40 that we would need to operate on, and the reason for that was really a genetic component for their valve disease.
Wow. Now, valve disease sometimes may not present with symptoms, and we're going to talk about that, but if it does, here are the most common warning signs when it comes to valve disease. Number one being chest pain. Is this correct, Dr. Elias?
Yeah, so chest pain is always an important symptom that we have to worry about. You have to rule out everything from an acute process like a heart attack, but other things such as valve disease can also cause chest pain because you're not getting enough blood out to the rest of the body, and you're putting too much pressure on the beating heart itself.
And it seems like some of these symptoms, like palpitations, the shortness of breath, they're very similar to that of someone who may be having a heart attack. So is that often confused?
Yeah, so when someone comes to the emergency room, I mean, one of the first things that we want to rule out right away is an acute process or something that we need to correct right away. So that's usually done in the emergency room. Once the acute processes are ruled out, then we start getting our echocardiogram, which we talked about earlier, and then we're able to try to fit together if the patient's symptoms are correlating to any type of valve disease that's going on with the patient.
Okay. Now we have a caller. We have Enrique from Miami. Enrique, are you there?
Yes, ma'am, I am.
Hi, Enrique. Thank you so much for calling in.
Good morning. Good morning, doctor.
Good morning. Go ahead.
Doctor, I don't know if you're in the same field. I have an abdominal aortic artery, and I've been monitoring for the past 9 years, and now they have detected that it has grown in a period of course, 9 years, but the surgeon says that he cannot do surgery until it gets to the size for surgery, which I'm an active 58-year-old man, so they have restricted me to doing basically a lot of stuff, so I'm a big concern. Maybe you can guide me and maybe guide me to where I should go to my next step.
That's a great question.
Yeah, it's a great question. So what we're specifically talking about is as the aorta comes off the heart, you go into different parts. The first part that you're going to get to is the upper part of the chest, also known as the thoracic part of the chest. And then the next part, which our caller Enrique is talking about, is your abdominal part, and that's your abdominal aorta. For some patients, the abdominal aorta can expand to the point where you're at risk for complications. And this is not specifically valve disease that we're talking about, but it is a vital part of imaging where we need to really focus in and see how big the abdominal aorta is, and then that can guide therapy. What I would advise you, Enrique, is to make sure that you're following up with both your surgeons and your vascular staff, because there are some minimally invasive ways that you can do this in a non-surgical approach, which may be useful if you're not offered surgery as a definitive treatment for your disease.
Great. Well, you really eased my mind a little bit more because I was a little bit concerned about it. So you've answered my question. I will follow up on it. And a great show, guys.
Thank you.
I watch it every morning, and I hooked up all my friends onto it.
Thank you so much, Enrique, and I hope the Dr. Elias response helped you. All right, so great question again. Now, but we have to move on to atrial fibrillation and what that relationship is between this condition and valve disease. So if we can discuss that a little bit.
Sure. So atrial fibrillation is a disease process that affects numerous amount of people in the U.S. It's a really important disease because it has has complications such as stroke, which is a very damaging part to the patient's quality of life. With valve disease, you can have atrial fibrillation because the chambers of the heart, specifically the atrium, are dilated, and that predisposes you to atrial fibrillation.
Now, are there other complications of heart valve disease, though? You mentioned stroke possibilities.
Yes. So yeah, heart valve disease can affect each portion and any portion of the heart. Besides atrial fibrillation, one of the unfortunate complications is heart failure, because if you're putting too much pressure on your heart because your valve isn't opening, then your heart can become weaker. And that can give you a myriad of symptoms, from shortness of breath to leg swelling to an inability to lie flat, amongst other things. And
eventually lead to that heart failure. I want to go over some of the causes of valve disease, Dr. Elias, and if we can go through these together. Sure. We discussed older age as being one of the causes.
Yeah, so older age, as you get older, the amount of calcium that gets deposited on your valves increases. So a young patient, obviously, when they're 50, 60, or 70, even, that's still considered young in our field, they should have no problems with most of the valves of their heart unless there's something else going on. But with time, as calcium deposits, the amount of flow that's going through the valves is going to be diminished, and it's going to become stenotic, and that's why older age itself from calcium deposits causes valvular disease.
And we're going to get into these a little more, like high blood pressure and high cholesterol and diabetes, but we know a little bit about what valve disease is, but coming up next, we'll be talking about the different procedures used to treat valve disease and how imaging is used to guide these procedures. You're watching the Health Channel, all health, all the time, on South Florida PBS. If you have a question for Dr. Elias, please call in using the toll-free number, 855-796-4475. And please be sure to visit our website, allhealthtv.com, where you can watch a live stream of the Health Channel and watch videos from previous episodes. We'll be right back.
I just need a second.
Is your weight holding you back and affecting your health?
Did you see this? Your cousin had a heart attack.
Really?
Excess weight or obesity can be serious, but you can do something about it. Visit yourweightmatters.org. Download the free toolkit to prepare you to speak with a healthcare provider. Your weight does matter. Accept the challenge and take charge today. Visit yourweightmatters.org.
Each year, an estimated 12,000 women are diagnosed with cervical cancer. Thanks to improved screening and vaccination, cervical cancer is a highly preventable and treatable cancer. Early detection is key. Women should pay close attention to their cervical health by following these guidelines. Start testing at age 21. Women between ages 21 and 29 should have a Pap test done every 3 years. Women between the ages of 30 and 65 should have a Pap test plus an HPV test done every 5 years. A woman who has been vaccinated against HPV should still follow the screening recommendations for her age group. Your particular health history may dictate a different screening schedule for cervical cancer. Contact your primary care physician to talk about your history and schedule your next screening today.
Families come in all sizes and shapes. Sometimes your friends are your family by choice, or sometimes you're just stuck with Uncle Charles. But what we know is that you want to protect the people that are close to you, but the flu can unravel everything. Your flu vaccine protects you and your family. No matter what draws your family together, protect yourself, protect your family. Everyone needs a flu vaccine.
At Children's Cancer Research Fund, we believe a world without childhood cancer is possible, but it takes all of us. And whether it's developing a groundbreaking treatment or helping a girl realize her dream, everyone has a role in a child's cancer journey. Just ask researcher Brandon Moriarty about his latest breakthrough, a genetic biomarker treatment.
Children's Cancer Research Fund is a great organization. They provide funding to really dig deep into the research and make more progress. We were able to start a clinical trial that's led by Emily Greengard.
The hope is that these types of therapies are going to be more effective and a lot better tolerated, a lot more safe for the patients.
People ask me how I keep a smile on my face. It's easy when you have so many great people that take care of you and support you.
To find out how you can be a part of the child's cancer journey and a part of the cure, visit childrenscancer.org, a public service message from Children's Cancer Research Fund.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio. And with us is Dr. Elliot Elias, Interventional Echocardiography Specialist at the Miami Cardiac and Vascular Institute. If you have a question for Dr. Elias, please call in using the toll-free number 855-796-4475. We'd love to hear from you. Now, let's talk about how valve disease is diagnosed, and we're talking about imaging. So is echocardiogram the main thing used to identify valve disease?
Yes, so for valve disease, it is really the main staple for diagnosing heart valve disease. There's other things that you can do which are more advanced, but this is the workhorse of diagnosing valve disease.
And one of the factors that you mentioned earlier was it really shows how well your heart is pumping that blood, but it also shows the size and shape of your heart valves and your chambers. Is this true?
Yep. So for each valve, actually, we do a dedicated view to assess whether it's opening enough, closing well enough, how much blood is going forward, and also worry about if any blood is going in the wrong direction as well.
For a healthy valve, Dr. Elias, we're looking at what is it's a continuous flow. Is there a specific movement that you're watching for a healthy valve?
Yeah, so when you're looking at valve disease, it starts getting more and more complex the more and more you know about it. To start from the basics, you really want to make sure that it's opening well and that it's closing well. The way that we can assess how well it's opening is simply by looking at the leaflets themselves. And you can see if something's not moving that much, anybody can pretty much tell that there's something wrong. The way that we can tell if there's things that are going in the wrong direction is with a way to actually look at blood flow during the image. So you're not just looking at the image itself, but you actually can look at which way the blood is going, forwards or backwards.
Now, so this means you're able to diagnose which valve or valves has problems and whether or not there's a stenosis or regurgitation. And that is thankfully because of this echocardiogram. Is this true?
Yes, yes. What you really start focusing on next is the severity of the disease.
Okay. Are there stages for severity? Okay.
Exactly, yeah. So once you start seeing that blood is going in the wrong direction, you really want to classify it as either mild, moderate, or severe. The reason that these categories have come into place is because once you get to the severe stage, this is the stage that has been diagnosed where the time where you would need some type of intervention or operation.
So is that when that heart catheterization comes in?
That's when procedures would come in. You may need to do something else to assess the full problem of the valve, but that is the time where if a patient comes to me and has symptoms and I'm looking at their valve disease, that's when I would advise them that we either need to go to a non-surgical or surgical route for fixing their valve disease.
Okay, so now once the condition has been diagnosed, the next step is deciding the treatment plan. So now that we know, when we talk about the aortic valve, if you have aortic stenosis, what are the different treatment options if you have stenosis, which, as you mentioned, is the most common?
Yeah, so the two main treatment options are surgery, and we'll classify it as non-surgery. Okay. When we're talking about the non-surgical field, we're giving the patient that's usually too high risk for surgery a chance for intervention to open up the closed valve.
Okay. And what about the other option?
So surgery has been the staple for treatment of valve disease for since the beginning of the start of the treatment of valve disease. Both are good options, and with time, I think we need to really get a better understanding of which one is suited for which patient.
And I think it's important to note as well, and for our viewers at home, that this is a team effort. And it's other surgeons, specialists are all in that room with that patient assessing the situation. So can you talk to us a little bit about why something like valve disease requires that kind of team effort?
Yeah, so that's one of my favorite parts about my job, actually, to be able to work with surgeons and the interventional heart disease specialist. The best way that I can describe it is our meetings on Tuesday morning, which we have at 7 a.m. And surgeons are in the room, the interventionalists are in the room, and the imagers, such as myself, are in the room. And we really need to pull together everybody's expertise to figure out how we're going to treat the patients.
Mm-hmm. And how useful is that in whether it's communicating or sharing notes or that particular case in treating a patient?
Yeah, so everybody has their backgrounds, which are pretty specialized. The surgeons have an enormous amount of expertise because they've been operating on patients their whole career, and they're able to contribute things as far as surgical risk and as far as approaches that we can treat each type of valve disease. The interventionalists, if we're not doing surgery and we're doing something that we'll talk about a little bit later, which is a TAVR, or a trans-aortic valve replacement, which is a non-surgical way to treat valve disease, are the people that are doing that type of procedure, and they are able to tell the group what they are and what they're not comfortable with. And then from the imaging side, we really want to get an idea of how bad the valve disease is, how we would operate, what types of approaches are possible, and making sure that there's nothing else that we need to offer the patient prior to treating their valve disease.
And you beat me to my next question, which is we're going to be talking about the procedure that is used to treat the aortic valve, and it's called transcatheter aortic valve replacement, or TAVR, which Dr. Elias just mentioned. So let's take a look at this video from Baptist Health South Florida that explains more about his procedure.
The aortic valve, located within the heart, allows blood to pass from the heart to the rest of the body. When that valve is blocked or damaged and symptoms develop, patients must have it replaced.
Their hearts can become very thick, and then they can have different symptoms. They can have chest pain, they can have syncope, they can have sudden death, and they can have heart failure.
Open heart surgery remains the recommended treatment for most patients, and heart surgeons at Miami Cardiac and Vascular Institute have some of the lowest complication rates in the country. But for those patients who are unable to endure open heart surgery, Institute doctors have been successfully using transcatheter aortic valve replacement, or TAVR. TAVR is performed using a catheter or hollow tube inserted into an artery elsewhere in the body or directly into the heart and threaded to the aortic valve.
Then the valve is deployed, is matched against the native valve. So the valve stays there, your own valve, plus we put a new valve. But it functions like if we do the same as an open heart surgical procedure.
Doctors at Miami Cardiac and Vascular Institute, located at Baptist Health hospitals throughout South Florida, helped develop this minimally invasive approach to aortic valve replacement. Now they're using it to successfully improve the lives of patients for whom heart surgery was not an option.
If you compare patients who have TAVR to patients who are treated medically in this elderly, sick population, definitely the patients that get TAVR have a better life expectancy and survival rate.
It's an incredible procedure, Dr. Elias. And I want to know, though, who would be a candidate for TAVR?
So most people are candidates for TAVR.
Okay.
The first thing that you want to make sure is that you actually have valve disease. So as we've been talking about, if you have severe So if remember, we're in those three categories: mild, moderate, or severe. So if you have severe aortic stenosis, then you would be a candidate for TAVR. I think that the main thing that happens for, as we talked about this valve meeting, is whether or not the patient should undergo surgery or TAVR. The two approaches are available for most patients, and the deciding factor up to this point is the surgical risk for those patients.
Now, how was the procedure done? I did see, watching the video, as you mentioned, it's a team effort. There were many people in that operating room. So tell me a little bit about, guide us through the procedure itself.
Yeah, so when you're looking at the screen there, you can see that there's a catheter that's going up through the aorta. As you see that the catheter is being expanded, the valve has just been deployed. And then what you're looking at right now is a valve that's opening or closing. There's different ways that you can get a deployment of the valve, and one of the main ways is just simply going through the groin, which is obviously in stark contrast to surgery when you're opening up the chest, even if you're doing a minimally invasive approach.
Now, once you're done with the procedure, will the patient need a separate or another echocardiogram?
Yeah, so they will. We'll always order echocardiograms. It's a relatively fast and efficient test to assess everything that's going on with the heart. We always want to make sure that our valves are implanted and functioning well, which is standard after all procedures.
Now, coming up next, we'll be talking about mitral valve disease and how it can be treated using an innovative procedure called the MitraClip. You're watching the Health Channel. All health, all the time. On South Florida PBS. If you have a question for Dr. Elias, please call in using the toll-free number 855-796-4475. And please be sure to visit our website, allhealthtv.com, where you can watch a live stream of the Health Channel and watch videos from previous episodes. We'll be right back. Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio. And with us is Dr. Elliot Elias, interventional echocardiography specialist at the Miami Cardiac and Vascular Institute. If you have a question for Dr. Elias, you can call in using the toll-free number, 855-796-4475. Now, before the break, we were talking about the aortic valve, and now let's shift gears and talk about the mitral valve. And just as a reminder, can you point out where the mitral valve is and what its function is in our heart?
Yeah, so as we talked about earlier, we're really dividing the heart into the right side, where the tricuspid valve, and the left side. When we start worrying about left-sided disease, one of the two main valves is the mitral valve, which you can see here. It allows blood to come in from the lungs and then fill this part here, which is called the ventricle, and then we pump it out to the aorta, and that gives the blood supply to the rest of the body.
Now, Dr. Elias, I know with this image we are looking at mitral regurgitation. Is this correct?
Yeah, so you can see these little specks of red here, which are actually blood cells, and they're going backwards, and when they're going backwards, they're going to go back into the lungs. And that's really important for our patients because they start developing problems breathing. And the reason that they're developing problems breathing is because obviously they have too much fluid in their lungs, and it's going to cause them to have symptoms.
So this mitral regurgitation, Doc, is this like a faulty valve is what we're looking at?
So there's a bunch of different reasons that you can have a leaky or a regurgitant valve. If the leaflets themselves don't come together and close correctly, then you'll have a leaky valve. If you look closely at the heart here, then you could see that the whole mitral valve is actually a mitral valve apparatus. When you look at two different leaflets, 1 and 2 here, and they're actually attached to these little strings here, which are called chordae, and they're also attached to a papillary muscle, which is here, and that allows the valve to open and close. So if any part of this mitral valve apparatus is diseased, then you can have a problem with your valve, and it can cause leakiness.
And as we mentioned earlier, when we were talking about aortic stenosis, there are different tools for diagnosing this condition. And some of those diagnostic tools, as we mentioned, Dr. Elias, the echocardiogram being first and foremost what is used. Can you talk to us a little bit about the rest?
Yeah, so the other three that you see on the screen are the electrocardiogram, the cardiac MRI, and cardiac catheterization. So the electrocardiogram will give us an idea of some of the parameters that may be caused by a leaky valve. If your atrium is enlarged, you may predispose yourself to atrial fibrillation. A cardiac MRI is a great tool that's a little bit more in depth in how a patient needs to be examined, and it's not as facile as an echocardiogram, but that can also give us some of the information that we need for diagnosing mitral regurgitation. And a cardiac catheterization is always essential to check the pressures of the heart and get an idea of how severe the valve process is.
Now, so using the echocardiogram, once the results are in, how do you and your team determine the best route of treatment for the patient?
So we'll usually discuss it in a multidisciplinary approach. The different disciplines that we'll bring in are radiology, surgery, interventional, and an imaging person such as myself. There's a myriad of treatments that are being available. One of the most common is the mitral clip procedure if you're not a surgical candidate. And with the advent of technology, I think we're going to see more and more surgical approaches being done in a non-surgical fashion.
Okay, I do have a question. So when it comes to valve disease, does it always need to be medically treated?
So the two forms is a great question. So the two forms of treatment are whether or not you're going to treat your patient with medicine or whether you're going to do a decisive treatment, such as an intervention with surgery or a non-surgical approach.
Okay.
What we try to do is treat the patients and give them individualized treatment.
Right.
So if we can get away with just treating them medically with medicines, then obviously we'll always do that. The tougher part is deciding whether or not we'll offer them surgery or offer them another type of procedure for the patient. And then that's when we get into the nuances of individualized patient care.
Treatment, right. Now, repairing the mitral valve is one of the ways valve disease can be treated. And we have a video from Baptist Health that explains how this repair works using something called a mitral clip. Take a look.
The mitral valve of the heart allows blood to flow from the upper left chamber of the heart, or atrium, to the left ventricle. If the mitral valve is blocked or damaged, allowing blood to flow back into the lungs, doctors recommend having it treated.
Mitral valve disease, once it becomes symptomatic, is something that can be addressed with medicines. But when the medicines don't work, or there is another problem that they can't take the medicines, then a procedure can take place.
And heart surgeons at Miami Cardiac and Vascular Institute have some of the lowest complication rates following heart surgery in the country. But for patients who are unable to undergo open heart surgery, doctors can repair the faulty valve with a mitral clip, a device researched in part at Miami Cardiac and Vascular Institute.
That is a totally catheter-based technology, and it is approved in patients who are extremely high risk for surgery or that cannot be operated because they're too ill, too sick, too weak, and this procedure works wonders.
Dr. Quesada inserts a catheter or hollow tube into a blood vessel in the patient's groin. He threads the mitral clip up to the area of the leaking mitral valve. He then places the clip around the leaflets of the valve, pinching the valve where the leak is, but allowing blood to continue to flow around the clip.
So you don't have to open the chest to do it. So patients who are not suitable, they're so sick that cannot get a conventional open heart surgery for repairing of the mitral valve can have this alternative approach.
Doctors at Miami Cardiac and Vascular Institute, located at Baptist Health hospitals throughout South Florida, continue to seek ways to minimize the impact of heart surgery on patients while improving the results these patients experience after their surgery.
So at the Miami Cardiac and Vascular Institute, we have this ability in patients who are really not good surgical candidates to take care of them and make them feel better and have a better quality of life.
And Dr. Elias, that's a pretty cool gig. You get to be in there and to do all these amazing procedures. So with the echocardiogram, what are the benefits to have something that's echo-guided when it comes to treatment?
Yeah, so the mitral clip procedure, again, just to take a step back, is a non-surgical procedure for patients that are too high risk with a leaky mitral valve. It's actually one of my favorite procedures because you're really using echocardiography and modern technology to give patients a treatment that they would otherwise not normally be able to get. So during the procedure, normally when you're in the cardiac catheterization laboratory, you're really using x-rays to guide where your interventions are. But for this specific approach, you really need to have a higher level of imaging, and that's why we put a camera within the patient to guide everything that's going on with this procedure. And it allows us to give real-time assessment of where the mitral clip is, how much leaking we've been able to stop, and whether or not we need to even put another clip or we're satisfied with our result.
That's absolutely incredible. Now, coming up next, we'll be talking about new innovations for valve disease, including a procedure for the tricuspid valve and something called the Watchman procedure. You're watching the Health Channel, all health all the time on South Florida PBS. If you have a question for Dr. Elias, please call in using the toll-free number 855-796-4475. And please be sure to visit our website, allhealthtv.com, where you can watch a live stream of the Health Channel and watch videos from previous episodes. Don't go anywhere.
Migraines are pulsating headaches that often occur on one side of the head. If you suffer from migraines, you're familiar with the throbbing, one-sided pain that makes you sensitive to light and noise and causes nausea or vomiting. Some home remedies for migraine pain include changing your diet, monitoring triggers, scalp massages, using an ice pack, anti-inflammatory herbs like peppermint or chamomile, and staying hydrated. Contact your primary care physician about treatment options available to you today.
SCAD stands for spontaneous coronary artery dissection, and it means there's a tearing in the walls of the arteries that bring blood to the heart muscle. In recent studies, it seems to affect more than 90% women compared to men. It's a disease that is not well known, but the causes can include certain types of artery problems such as fibromuscular dysplasia and other connective tissue disorders, as well as being peri or postpartum, and then other things such as emotional stress or extreme physical exertion. The main signs and symptoms are presenting with a heart attack, and those signs are chest pain, trouble breathing, any type of discomfort in the chest. People may feel lightheaded or dizzy or sweaty, and if you happen to have a predisposing disease of the blood vessels, then definitely have a low threshold to getting help.
C stands for cutting-edge research, clinical trials, and collaboration. Creating breakthrough treatments as Florida's only member of the Memorial Sloan Kettering Cancer Alliance. At Miami Cancer Institute, C also stands for CURE, world-class cancer care right here at home. Learn more at miamicancerinstitute.com.
In the past 50 years, we've made a lot of progress in smoking prevention. But if we don't do more, 1 out of every 13 children alive today will die early from smoking. That's 5.6 million precious lives we can save. Together, we can make the next generation tobacco-free.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio. And with us is Dr. Elliot Elias, interventional echocardiography specialist at the Miami Cardiac and Vascular Institute. If you have a question for Dr. Elias, please call in using the toll-free number 855-796-4475. Now, when it comes to valve disease, what are some of the innovative procedures that are on the horizon that we can expect?
So this is a huge field within cardiology. Anything that you can do surgically, we're going to start at least attempt to do in a non-surgical way. There are procedures that have actually already been done where we put in a full mitral valve, which is different from the clip that we showed before.
Ooh, how was that done?
So you can actually do it through the apex of the heart when you're doing a small surgical cut down. So instead of a full surgery when you're opening up the chest of the heart, you can place a valve through a catheter that goes in through the apex of the heart. And another thing that has been done is a tricuspid valve, and these are both in the early stages of development, but I think that with time we'll see that these are going to become more and more commonplace.
I want to talk about the tricuspid valve. We do have an image that shows the different heart valves, and with using this image, we're going to talk a little bit about that tricuspid valve. Can you tell us a little bit more of what it is?
Yeah, so we actually used to think of the tricuspid valve as a valve that wasn't important. They used to actually say, maybe we would just cut off all the leaflets if there's a problem, and we'll just make one simple chamber,
right,
and not even worry about it. With time, we realized that this approach wasn't the best approach for this valve. And now what we're realizing is that the right heart is just as important as the left side of the heart. When I mean the right heart, if you look at the diagram there, you can can see that the tricuspid valve is on the right side,
Right.
and then the mitral is the valve that we're talking about on the left. So as we've been talking about, either the valve is very closed or very leaky. The most type of problem with a tricuspid valve is that the valve itself is very leaky. One of the ways that we can treat a leaky tricuspid valve is with a tricuspid clip, which is being worked out as far as how good it is for the patient. And there's actually valves that we can implant into the tricuspid annulus.
When you say tricuspid clip, that's the same thing as the mitral clip.
Yeah.
Okay.
So I have to tell everybody on TV to that these are not commercially available yet, but as everything happens in medicine, we have to start somewhere.
Right.
So there are trials that are out that are assessing whether a tricuspid clip is the best thing for a leaky tricuspid valve, and we're also looking at putting in a full surgical valve into the tricuspid valve. It's very exciting, but again, I just wanted to be clear that it's not commercially available yet.
While it's not commercially available, is this something that you and your team are working on at Baptist?
Yeah, so we actually implanted one of the first tricuspid clips just 2 months ago. This was a patient that had leaky valves in the mitral position on the left side, as well as the tricuspid position. The reason that we decided to do this is because the surgical data shows us that if you're going to treat the left side, the mitral valve, that the patients that also get treated for the right side of the tricuspid valve when they're leaky have an enormous benefit in terms of mortality and in terms of quality of life. So when we went ahead and we planned this procedure, we planned to do both sides, and we had good results on both sides.
And when you, since this is not available to patients yet, but when you do work on a patient and give them this possibility, is it usually met with
Yeah, so the patient that we did this on, he was about 80 years old, and he was evaluated by surgeons at other hospitals, and he was deemed that he wasn't a surgical candidate.
Wow.
So he came to our hospital, and we treated him for with 2 clips actually in the left side and 1 clip on the right, and it was really remarkable to see how well he was doing in terms of his symptoms. He came to us and he could barely walk out the door, and after that he was able to have less shortness of breath, and he was really able to walk much more than before.
Now, why is a procedure like this so important for the field, Dr. Elias?
Yeah, so I think that this field, and the reason why I personally am fascinated with it as well, is because we're really offering non-surgical approaches to patients that wouldn't otherwise get treated surgically, like this particular patient. And as we evolve and as we can grow, we're going to get better and better at these diseases, and we're going to really make a higher and higher impact on patients' quality of life.
Absolutely. Earlier, we talked about how valve disease can cause atrial fibrillation. However, when AFib is not caused by valve, a device called Watchman can be implanted to treat the condition. Take a look at this video from Boston Scientific Corporation that has more on that.
This is the Watchman implant, a one-time procedure that may reduce your stroke risk for a lifetime. In people with atrial fibrillation, blood clots most commonly form in a part of the heart called the left atrial appendage, or LAA. If a clot escapes, it can cut off the blood supply to the brain, causing a stroke. Closing the left atrial appendage is an effective way to reduce stroke risk in people with AFib, not caused by heart valve problems. Watchman is the only implant approved by the FDA to do exactly this. Watchman can be a life-changing alternative to the daily use of blood thinners and the bleeding risks that come with them. Talk to your cardiologist so you fully understand all the benefits and risks of Watchman. See if Watchman is right for you.
Well, with a name like Watchmen, it sounds like it's a new Marvel movie coming out. And it does pretty spectacular things, though. So can you walk us through about the procedure with Watchmen?
Yeah, so we need to start from the basics. The first thing that a patient that would have a Watchman implanted would be atrial fibrillation, as the video talked about. The most important thing that I tell my patients with atrial fibrillation is that they're at high risk for stroke. The reason for that is because the blood is not circulating as well as it normally does. One of the most common places for stroke to develop is the left atrial appendage. So the Watchman device is implanted in the left atrial appendage to prevent those clots from forming there. And when it was compared with medical therapy, it was compared that either the Watchman device or medical therapy itself would prevent stroke in an equal fashion.
Wow. Now, thank you so much, Dr. Elias, for being here. I feel like we've learned so much about valve disease and all these amazing new procedures we'll be looking forward to at the Miami Cardiac and Vascular Institute. So thank you again. Be sure to join us next time on the Health Channel, All Health All the Time on South Florida PBS. And follow us on Facebook, Twitter, Instagram at All Health TV, hashtag All Health TV, where you can get health tips from our experts and see what's coming up next on the Health Channel. You can also visit our website, allhealthtv.com, where you can watch a live stream of the Health Channel and watch videos from previous episodes. I'm Kathy Buccio. See you next time.